My name is Mitch Cook. I'm a retirement plan advisor here at Accel Wealth Management. Part of our advisory services within Accel Wealth Management is to provide retirement plan education, financial wellness services, and meet with individuals for their personal financial goals and objectives. I have my colleague here, Jared Deines, joining us today. He is one of our employee benefit advisors, and I very much appreciate you taking time out of your busy time of the year, Jared.
Absolutely. Yeah. Happy to do it, Mitch.
Fantastic. Well, as you can see, today we are talking about the advantages of health savings accounts, HSAs, for those of you that may have, I guess, been involved in them for quite some time. But before we really get started, I just want to share a few housekeeping items. There is a Q&A box on your screen. If you do have any questions, definitely open up that Q&A, ask your questions. We are going to hold that off until the end just because this is a recorded session, but we'll make sure to address any questions that you have along the way. As always, we need to make sure all of our disclosures are in there. This is an educational program for information purposes only. Really understanding kind of the agenda today is really focusing in on health savings accounts. It has become more and more popular, especially over the last 5 years. And what we're seeing a shift when it comes down to medical benefits. And really today we want to kind of focus in on what are the key values of these HSA health savings accounts that are part of that high deductible plan. And we're also going to share some changes that has just recently happened this year with the big beautiful bill. They added some additional options, some flexibility within the HSA accounts. But really for our agenda, we're going to highlight, what is it? What are the benefits, contributions? And those tend to be indexed every single year. How the distributions work, what would qualify for them, and then the resources that are really available within them. So I'm going to hand this off over to Jared here. He's going to start kind of getting into really the key mechanics of the HSA.
Yeah. Yeah. Thanks, Mitch. And I would say that probably, 8, 10 years ago, HSAs were kind of newer to the market. I would say about, maybe 10, 15% of our employer groups were offering them. But now it's almost everybody is at least offering it as an option. And what it is, it's a higher deductible health plan. So that the HSA is actually the savings tool, which is triple tax advantage. We'll talk about that in a little bit, but very similar to a flexible spending account, so the FSA. But the nice thing about the HSA is that these funds roll over year after year. It's actually your money in a bank account that you can set aside pre-tax money out of your paycheck to use for qualified medical expenses, and not pay taxes on the back end. So individually owned and can be invested. A lot of them, a lot of these accounts, there's maybe a minimum of $1,000 to start investing. But again, it's your account, and you take it with you, even if you change employers or let's say you switched health plans back to maybe a traditional plan, you would still be able to use those funds in an HSA for your qualified medical expenses. Yeah, so again, this is an account that you can set up. A lot of our employer groups will sponsor kind of a custodian that will have a direct integration with payroll where you can set that money aside. But this is a plan that you have to be enrolled in a qualified high deductible plan, and what that is, essentially, it's a health plan with no first dollar coverage. So when we say first dollar coverage, that'd be your copays, so your office visits, prescription drugs, emergency room copay. The HSA, essentially everything, all of your claims are going to flow towards your deductible and your out of pocket. And then once you've hit that, everything is covered for the rest of the year. So kind of the advantage of the HSA or the high deductible plans, the HDHPs, typically going to have lower premiums, so lower monthly premiums coming out of your paycheck. And what we found is the out of pocket maximum is typically lower than the traditional plans. So more of a catastrophic plan. We like to use the analogy sometimes you don't buy car insurance for your oil changes. It's kind of the same thing on your health plan. Do you really need health insurance for your PCP visits, different things like that, where essentially you can pay that as you go, but you've got the over-the-top catastrophic coverage if anything were to happen. Yeah. So again, in order to be eligible to make contributions into an HSA, and I think we'll talk about a little bit what those max contribution limits are and what they're going to for 2025. But you've got to be enrolled in that qualified HDHP. If you're not sure or you're not sure if your employer group offers that, typically a question you could ask your HR, or if you have a contact with your benefits provider, they can help you through that. But then again, another benefit is there's no income limit to contribute into your HSA. And I think we'll talk about there's a catch up for people that are over the age of 55, where you can contribute an additional 1,000 on top of the maximum.
Perfect. Well, we're going to have our first question. Which savings option offers the best potential tax advantage? Receive a tax deduction in the front end, it grows tax deferred, and you can receive a tax-free distribution. Is it flexible spending accounts, traditional IRA, health savings accounts, Roth IRA? I think this is pretty unanimous when we're we're definitely talking about the topic itself. Um, yeah, absolutely. The health savings account is really what we're talking about. And as Jared mentioned, the big reason behind the triple tax advantage is exactly what we're talking about. The contribution goes in pre-taxed. So you're getting that tax benefit today off of your income as that money goes in. The earnings, the growth on it is tax deferred. So you don't get any impact on that. But the biggest key is as long as you use that account for qualified distributions, medical expenses, dental vision, whatever those may be, it is a tax-free distribution. And as we go through the session today, a big part that we're going to highlight is why are these accounts now being looked at, not just as an immediate need today, but as a retirement savings account in the future.
Yep.
So Jared's going to highlight, what is that kind of ownership portability? He's hit on that a little bit, and a couple other things about the savings in an HSA.
Yeah. Thanks, Mitch. I think most people are familiar with kind of the idea of like a flex spending, the FSAs. The nice thing about the HSA is it's not a use it or lose it at the end of the year. The funds in that account will roll over year. So as long as that's in there, and as long as you're still enrolled in a qualified high deductible, you're able to continue making contributions to it. But that money's not going to go away. It's like I said, it's your account. Even if you change health plans, change employers, you still have access to those funds, and you can still use them for qualified medical expenses. And you're not going to lose the funds if you haven't used them at the end of the year. So in addition to kind of, your deductible, paying for your claims as you go, there's also a large list. I know Amazon's got their own FSA, HSA store, which are all eligible expenses to use on your with your HSA funds. So people are looking at it not only as kind of a way to help pay for medical expenses, but also as kind of Mitch has alluded to, a way to save for retirement. I think one of the things that a lot of people are using these for is you can actually pay for your Medicare supplement premiums with your HSA funds. So again, triple tax advantage way to pay for those expenses, medical expenses, when you get to retirement. There is a 20% penalty if you use those funds for something that would not be a qualified medical expense. So just something to be aware of, making sure, we're saving receipts, we're using things. The nice thing with the HSA, very similar to the FSA, is a lot of these accounts will issue a debit card. But very important to make sure that you're using these HSA funds for qualified medical expenses. Again, just more examples. Prescription drugs. You can even use it on dental and vision, similar to your FSA. And then we talked about Medicare premiums, but also COBRA premiums. If you were to leave an employer and be eligible for COBRA, just a large variety. And Mitch, I think you've even got an example of a client who has this HSA fund, but is paying for medical expenses out of their pocket because they know the benefits of the long-term tax savings. I don't know if you want to hit on that quick.
Yeah, and as you pointed out, Jared, taking a look at where this benefit's going to be in the future, that focus on the retirement savings aspect. If they know that they're going to have higher expenses down the road, they may be in a higher tax bracket down the road. And in this particular situation, I mean, based on what their expectations are, they really do feel they will be. And so they are really focused on using this HSA as more so as a future benefit,
Yeah.
and how that can be have a more impact for them down the road. I'll highlight some of the statistics here in a little bit, but every person's going to be in a little bit of a different situation scenario. But it is one of those things that when we meet with individuals and households, we do talk through this as, is it more advantageous to use this account today? Or do we use this as more of that retirement savings growth because we know of that tax-free distribution they can get from it? That kind of leads us into the next trivia question. How much in additional medical expenses will a retired couple have in retirement? So remember, this is a retired couple. Is it an extra $100,000, 250,000, 330,000, 500,000? It's uh, it is very daunting to think on how much there could be in additional medical expenses. Well, the answer to this is actually 330,000, but that continues to go up. As we continue to see the expenses in the medical world and all of the different things that a retired married couple could go through, there's that expense is only going to continue to be higher. What is amazing is, and I wouldn't say amazing, but daunting. Right now, a 65-year-old individual is paying about $6,500 a year in added medical expenses. A couple is spending about $13,000 a year right now in retirement, and that's only going to compound. That's about $1,000 extra a month if we think about that as a retired couple. I also break it down in perspective. That's about 25 to 30% of the Social Security benefit, the average Social Security benefit that somebody's getting. So if a lot of households are relying on that Social Security benefit, about a third of that is is going to be going towards these added medical expenses. Now, keep in mind, this stat, it's only looking at really the Medicare premiums, prescription drugs, routine out-of-pocket medical expenses. It is not including other expenses such as dental, vision, hearing, or long-term care. So for those of you that were thinking, well, I was thinking of the dental, vision, hearing to get to that $500,000, you might not be far off at that $500,000. So really it's just understanding the importance of that. So why is that HSA important now for us to look at? And a lot of people may not have realized this is something for a retirement benefit. As mentioned, this is based on a study with the 330,000, but it really gets down to that additional healthcare expense that we just don't know what's going to be. And if we have that ability today to be able to have, in essence, a retirement savings vehicle that gets the benefit like a traditional IRA, You get pre-tax, get that tax advantage today, but it gives you the benefit of a Roth IRA where you can get the distribution tax-free. This is why HSA, if this is something that you are doing that high deductible plan, you are eligible to contribute into, it's actually becoming more important to start utilizing this as a savings vehicle. So what are the limits? Well, the limits today in 2025. So if you do still have time, you could potentially max out the limits. If you are in that high deductible account, for a self, it's 4,300. For a family, it's a little over 8,550. And then 2026, they are increasing. So 4,400 in 2026, 8,750. Now, if you are over age 55, you do have the ability to make an additional $1,000 catch up. So just know that that is something that you can compound and add on top of it. But with that, we now have some additional flexibilities with the HSA account, that high deductible plan. So first and foremost, if you are at that age 65, or you're at an age where you are in one of those Affordable Care Act plans, if you're in the bronze or catastrophic health plan, you now have the ability to set up an HSA account. That was something that came out of it. So if you're an individual that is part of that open market, definitely something to look into. The other thing is, it gave the opportunity to have what they call as an income-based contribution boost. So the amounts that I just shared with you for 2025, that individual limit, if you make less than 75,000 as a single individual, you can actually put an additional 4,300 on top of that 4,300 limit. If you're married, you can do that at an additional 8,550 above the limit of 8,550 if you're making less than 150,000 as a married couple. So definitely an additional powerful way of contributing. Other things that they've identified is you can now use your HSA account to cover fitness and gym memberships, depending on individual or family. If you do have a flexible spending account as a spouse, there was sometimes there was restrictions on whether or not you can make a health savings contribution through the high deductible as as the individual that would be available, while they removed that restriction altogether. There are other ways. I know that Jared had mentioned, a flexible spending account. Normally, you get to the end of the year, you have to use it up or it's a lose it. They did give some additional discretion to the employer that if there is some money left over and you move into a health savings account the next year, you might be able to roll over some of those monies instead of losing it. But again, that's at each employer's discretion. And then there are plans called or arrangements called DPC. That's direct primary care. Usually that's a monthly membership fee. You can now actually use an HSA account towards paying those fees. So there's definitely a lot of great opportunities with HSAs, depending if you have that available to them. If we do look at this as a focus, as like a retirement type of an account, the biggest thing to be aware of is many HSAs that you set up, you can actually set up with investment options inside the accounts. And that gives you that feel of a retirement growth type of an account. And so it's just being aware that it's there. It doesn't necessarily have to be set up directly with a bank and in a low interest account. But if this is something that you are now thinking, okay, maybe I do need to focus as more of a retirement savings account, you can incorporate investment options as part of that HSA. And there are definitely a few vendors out there, and depending on who your program is through today, those programs already today may have the availability to have these investments built into it. So what are some of the distribution rules? I don't know if Jared, I know you hit on just a little bit of the distribution of the, for age 65, but I didn't know if you wanted to highlight a couple more things.
Yeah. I think one of the added benefits, similar to the FSA, but with the HSAs, you can use this on any spouse or any dependents that you have. You're able to use your HSA funds to pay for their qualified medical expenses, even if they're not enrolled on your HDHP. So, and again, we talked about if funds are used for non-qualified medical expenses before the age of 65, there is that 20% penalty. But I think it's just to highlight that it's for the whole family, not necessarily just for the policyholder who these benefits are for. Yeah, again, just wanna make sure people are aware of the 20% penalty prior to the age of 65, or if these funds are used on non-qualified medical expenses. So it is a great benefit, but just to be sure that you're using those funds in the right way. Medicare and long-term care premiums, again, we mentioned this, so this is another way that people are using their HSA to plan for retirement. Where if you've got a balance in there and you're able to kind of get some of these tax benefits while you're paying these premiums, you can use your HSA funds for the Medicare and long-term care premiums. Ineligible medical expenses. So this would be, again, there is an extensive list, and a quick Google search will show you all. Yeah, I mean, anything from prescription drugs at a pharmacy to SPF 30 sunscreen is a qualified medical expense. But just to be sure that you're using these funds correctly. Cosmetic surgery, if there's not a medically necessary need for that, would be ineligible. And then any expenses, if you're enrolled in another medical plan, not the qualified health high deductible, those would be subject to that 20% penalty.
So, what happens if you have one of these HSA accounts? What happens? Basically, what and it is very going to be very similar, I guess you could say, for purposes of like a certain qualified account. If you have a spouse, it becomes their account and they continue to enjoy that same tax benefit. But if it's a non-spouse, so this would be like your kids, the HSA will be liquidated and passes to that person, which they may incur a tax liability. So there is no tax benefits that get passed on to a non-spouse. Charity, I mean, you could definitely set it up where it goes to charity and it just liquidates and passes tax free. Just keep in mind, I mean, it is just an asset that you own. It's just you and your spouse are the ones that really get to take advantage of that HSA. And you're the one that has to name who that account would be set up for. Probably the biggest thing is, and I haven't, knock on wood, I haven't seen anybody get asked, but just keeping the records for at least 3 years, those receipts, making sure that that debit card, you can use that debit card for pretty much about anything. But the key is you want to make sure they have receipts to back up those qualified distributions. So it's just making sure that you have that track record available and have that on file down the road just in case. How do you access your HSA funds? Well, a lot of the time, and most of the time, you'll get set up usually with a debit card. Um, and and that usually is tied to an account where your current payroll deduction goes into. Now, individually, there are ways that you can make contributions into one depending on what your eligibility is. But again, depending on where that institute is, how that HSA is set up, the debit card is usually the primary way that we tend to see people access their account. But there are other ways if you have receipts where you want to get reimbursed for. One of the things that did come out with the big beautiful bill that I did not share is they do allow for people to look at previous healthcare expenses 60 days prior to becoming eligible into a high deductible or health savings account. So let's say right now you hit the end of the year, you're not in a high deductible one, but you start January 1st into one. Well, now you can actually look at those expenses that you had from November 1st until January 1st, and start using that high deductible plan starting next year. So again, uh, some great things that did come out of that big beautiful bill to help individuals. So what are some action items? I mean, just know that enrollment is optional. I mean, when you get into a high deductible healthcare plan, I mean, you don't have to get into an HSA account, but it's highly recommended that you do start setting up some additional money to set aside to help pay for any of those out-of-pocket expenses. And then again, making sure to evaluate the contribution amount. If you are looking at this more of a long-term strategy, especially from investing, taking advantage of maxing out those contributions each year. That triple tax benefit, there's no other option out there that is going to give you that level of advantage when it comes down to saving, growth, and distributions. Uh, Evaluating the pros and cons. I know a lot of people, they may be maxing out their 401k contributions or Roth IRA contributions, but may only be putting in $1,000 or $2,000 into your HSA. Definitely reevaluate that. Take a look at that. And of course, plan for today. Your future self will definitely thank you. Just a couple things. Our next two roadmap series before we finish out the year, we have the next one coming up this month in November. Appetite to satisfy your finances. So we'll be looking at a lot of various app-based programs that could help you simplify that or give you some ticks, tricks, tips, tools that can make things a little bit better. And then in December, we're going to have identity theft, protecting your digital self. So we're pretty excited to have both of these coming up here these next 2 months. I'm going to open it up for any questions.
Did Jared say if you are under a different plan, such as an FSA, and you use money from an HSA for medical bills, will you get hit with the 20% fee?
And no, Mitch, correct me if I'm wrong. I think the main difference here, or kind of what I was trying to hit on, is if you're enrolled in that qualified high deductible plan, that makes you eligible to make contributions to an HSA. But if you switch to an FSA, you can still use your HSA funds to pay for medical expenses. Yeah, I would probably recommend using those FSA funds first, just because it is a use it or lose it, and that HSA will roll over with you. And again, the investment options inside of that, but there would not be a 20% penalty if you use those funds.
Yeah, the biggest thing about the HSA is just knowing that that is yours forever until you die. And you can use it for any qualified medical expenses. And that's why it becomes very important in retirement. You're not going to be in any group benefit program that would be eligible for the HSA, but now you can start using that for those added medical expenses in retirement. But 100% concur with Jared. Use those FSA funds first. And then if needed, definitely dip into the HSA.
It says my spouse will need insurance through another source once I retire. How do we know whether or not we can pay premiums using our HSA account?
That's, I mean, a very good question. And the biggest part, and that's really sitting down. We can sit down with you because there's going to be a lot of different plans that are going to be available to you, depending on whether or not your spouse is going to be eligible for a group plan through their business if they are working, or if you need to go to the open market. And in many cases, you can definitely utilize that HSA account to help with those premiums in that ACA approved program, if that's the case. But it's just really sitting down to make sure dot your I's, cross your T's, and we can definitely sit down and go through that conversation with you, whether as from a wealth advisor or from an individual personal health advisor. We have both of that available to you.
Yeah, I would just add, I think if it's Medicare and the Medicare supplements, you would be able to use the HSA funds. If it's the individual ACA marketplace plans, I do not think that those are HSA eligible.
Would LASIK be considered cosmetic, or would it be covered?
That's a great question. I mean, I think one of the biggest things that I would have to do on the LASIK is go out to that approved list and take a look at it. If it is one of those situations where a doctor has identified that doing the LASIK is for medical reasons, then I would lean towards the fact that yes, it would be. But if it's more so, I want to get it done, just correct that little bit of vision. Um, but that's a great question. I haven't personally had it done, so it's hard for me to answer that. But a lot of
Yeah.
it really comes down to, is it really for medical reasons?
I've had a couple members with some of our employer groups, and yes, the LASIK is HSA eligible if you have any of like the cosmetic add-ons, like a maybe like an eyelid reduction surgery that's not medically necessary, then that would not be eligible for your HSA funds. But LASIK itself is always medically, like the doctor approves it, it's medically necessary, and it would be HSA eligible.